Hi, everyone. Welcome to Kansas Avenue's Healthy Lifestyle presentation featuring Dr. Yesenia Pinnock. We welcome you to this presentation and hope you have a great time. I'm very excited, and I'd like to open up with a word of prayer. Dear Lord, thank you for this day. Thank you for bringing us together to learn more about how to take care of these bodies that you provided for us. Please help us to learn a lot. Please bless our presenter and help her to really portray exactly what she wants to say and give us all the health tips that we can. In your name, amen. So thank you, Dr. Pinnock, for joining us. I would like to give a short bio so that our audience can get to know you a little more. Dr. Yesenia Pinnock, DDS, worked as a dentist in oral surgery for adult and pediatric dental care. She graduated from the Latin American University of Science and Technology, and she has completed additional dental training over time. Since 2003, Dr. Pinnock has been practicing as a dentist in rural communities with vulnerable individuals and in Indian reservations with the Costa Rica Social Service Health System in the Atlantic area of Costa Rica. The Social Service Health System is a governmental organization responsible of safeguarding the public health of Costa Ricans. Over the years, Dr. Yesenia Pinnock has developed a passion for providing dental health service to some of the most at-risk individuals in portions of the Atlantic area of Costa Rica. Dr. Pinnock's mission has been to serve as a channel of blessings by reaching out to the most vulnerable communities. She is an active member of the Commission for Environmental Management of the Costa Rica Social Service Health System in her local community. Dr. Pinnock is very active in her church as well. She is involved in several church activities and presently serves as the director of health ministry of the Limon Central Seventh-day Adventist Church in Limon, Costa Rica. If I take good care, thank you for joining us, Dr. Pinnock. It is a
Thank
pleasure.
you for
And
me. My pleasure.
of course, and I will pass it off to you, and we're excited to hear what you have to say.
Yes, thank you. So, well, good night to everyone. Thank you for joining us. And I'm so excited to share this topic with you because it is so important for us to have in mind that when it comes to oral health, prevention is key. So, Ashley, I don't know if you're able to share your screen with us.
I do not have the ability to share
No,
that PowerPoint.
no, go ahead.
Okay. I do not have access to the PowerPoint, so um, if you want to share and try to
Okay.
describe what is in the PowerPoint. I'm not sure. I'm sorry.
So if you want me to go ahead and then we catch up if you're able. Okay.
Yes.
So,
Okay.
okay, our topic for tonight, oral health prevention is key. Okay, so the main question is, what is oral health? Because we hear about oral health. It's important to have our teeth healthy or mouth healthy. But what is oral health? Okay, so according to the World Health Organization, oral health has been defined as a state of being where the individual is free of mouth and facial pain, okay? Free of oral infections, free of sores, and any oral disease that can limit the individual's capacity of biting, of chewing, speaking, and of having a psychological well-being, okay? So basically, oral health is when our teeth or gum or tongue or facial muscles and our bones are able to function correctly, when they're able to do what they are supposed to do the right way without any pain. And when it comes to the oral cavity, there are many structures that are going to come together for it to work properly as a whole. But today we are going to focus on the health of two structures in our oral cavity, which are our teeth and our gum. Okay, so to begin, what are the main functions of, of our teeth? When we think about our teeth, we normally think of chewing. We think on chewing, right? But our teeth have many other functions. And today I'll mention the three main ones. The first, the primary and the most known, as I mentioned before, is that of breaking down the food for swallowing and for further digestion. In other words, we need our teeth for to be able to chew when we are eating. So, as we know, the whole digestive process is going to begin in our mouth. But if we are not chewing properly, then the rest of the digestive system is going to become confused. And eventually, we're going to develop um, digestive disorders, like, for example, bloating, heartburn, diarrhea, acid reflux, excessive gas, and the list goes on. And this is the reason why it is so important to replace each missing tooth, because each and every tooth that we is have a different purpose, a different function when it comes to chewing or food. Okay. The second function of our teeth is enabling to produce to for us to speak correctly. Whenever we pronounce or letters, like for example letter S or the letter F, we need our incisors to be able to pronounce these teeth. Our teeth work along with our tongue and with our lips for us to pronounce correctly when we speak. So our teeth are very important when it comes to speaking and pronouncing correctly. And the third function of our teeth is that they also help in shaping our face or facial structures. Okay, or teeth not only help us to have a beautiful smile, but they also help the bones or facial bones to develop. during the growth process of the children and youth. Okay, whenever we miss a tooth, normally the bone tends to reabsorb. And if a child during his process of growth is lacking a tooth, whether genetically or because they have lost it because of cavities, this is going to develop problems with their bone structures or their maxillary bone structures. Okay, so now what's the parallel between or the relation between prevention and oral health? What's the relation between these two things? For you to understand what prevention and oral health has to do with each other, I first need you to understand what is dental plaque, okay, or dental plaque. Why? Because this dental plaque is the root. It's the origin of most of our oral diseases. So basically, the dental plaque is going to be described as a sticky film. This sticky film, it contains bacteria and other microorganisms that grows within the surfaces of the mouth, like between the teeth and behind the teeth, in chewing areas, along the gum line, below the gum line, and also it can form on our tongue and our gums. So at first, this dental plaque is is colorless and it is so thin that you can hardly notice its presence. Um, so we as dental professionals, we use a special disclosing solution for us to be able to disclose this dental plaque. And many times, especially when we have kids in our dental office, what we do is that we tell them to brush their teeth, and once they are done brushing, we drop 2 or 3 drops of this disclosing solution on their tongue. And once this solution is has been on all the surfaces of the teeth, wherever it's stained with this solution, normally it's like pink or red, whatever surface of the tooth is staying with this solution, there is where the dental plaque is. So many times, even parents, they're surprised to see how, even after brushing, there is still dental plaque on the surfaces of or teeth. Okay? And the reason why I want you to get this concept of the dental plaque is because the this plaque is one of the major causes of dental decay and gum disease. Okay, this film that seems so insignificant, so harmless, because it's invisible to the naked eye, it can eventually cause so many problems in our oral health. So what can we do to remove this bacterial plaque? Um, Basically, with proper daily oral hygiene, we can take the upper hand in the battle against the dental plaque. What are we going to do? Well, number one is by brushing our teeth correctly. Before we choose the best brush or the best toothpaste, it is highly important for us to be able to know what is the best technique of brushing. We need to know how we are to brush our teeth. So even if we have the best tools to clean our teeth, if we do not know how to use them, then there won't be of much benefit. So according to the American Dental Association, the proper brushing technique is the following. So let me show you here. We're going to place our toothbrush at a 45-degree angle, and this is like something like this, okay, along the towards the gum. So let me see. I think here you can see it. So we're going to basically place the brush in a 45-degree angle, okay, towards the gum line, and gently move the brush back, backwards and forwards like this, and then we sweep down, okay? It's always recommended that whenever we are going to brush our teeth, to always begin doing it at the same side. So if we are going to begin at the upper left, it is recommended to always begin at the upper left, so we will not leave any section out, okay? So we begin here, we do like this, some few strokes, and then we brush down, okay? So we move forward. Let's not try not having more than 3 teeth at a time, okay? So we're going to brush no more than 3 teeth at once, strokes, and then down. We advance until we reach to the opposite side. Once we have reached here, then we go down, and at the bottom, we're going at the lower, we're going to do the same side, the same thing. 45 degrees, okay, strokes, and then brush upwards, okay? Strokes and then brush. Strokes and sweep upwards, okay? Upwards. Until we reach at the opposite side. Then we open, and at the inside, we're going to do the exact same thing, okay? 45 degrees, strokes, and downward. We do this several times, okay? And then we move forward until we reach the opposite side. There is something I think it's very important to mention here, that under no circumstance we should forget to brush our tongue. It is highly important to remember our tongue. So if we are going to brush our teeth twice, 3 times a day, that amount of times we also are going to do our tongue. So basically, we just stick our tongue out, and then if we are going to, we can use whether a brush or a tongue cleaner. And if we're going to use the tongue cleaner, then we just place the tongue cleaner in the back of our tongue, and we move forward several times. If we're going to use the brush, then the same thing, we just stick our tongue out, we place the brush at the back, and we brush back and forth several times. Okay. So the second recommendation after brushing is also flossing once a day, at least once a day. It is recommended to clean between our teeth daily, because the dental floss is going to help remove the plaque and the food particles from between our teeth, and also those particles that are under the gum line, where these toothbrush bristles are not always able to reach. Okay, sometimes our teeth are so close together that the bristles are not able to go in between. So there's where the floss is very important. The correct way to floss our teeth is by using about 18 inches of floss. You wrap it around your middle fingers, and then you hold it, and and place it in between each tooth. Once you place it in between the tooth, then you take the floss and you form like a letter C around the tooth that you want to clean, and then you move. If it's the lower tooth, then you move it upward, and if it's the upper, then you move downwards. Okay. Another recommendation is the interdental brushes. It is important that for you to know that the interdental brushes are very helpful for hygiene. It is a important tool because they have some tiny bristles that they can fit in between the teeth and even under bridges. If you have bridges, the best tool are the interdental brushes to clean in between and under the bridges. Now, the mouthwash. There are two different types of mouthwash. There is the therapeutic mouthwash and the cosmetic mouthwash. Well, the cosmetic mouthwash will basically help you have the sensation of fresh breath for a period of time after you finish brushing. And in contrast, the therapeutic will help um, eliminate some of the bacteria that can eventually cause tooth decay and gum disease. So it is always important for you to consult with your dentist what type of mouthwash is best for you according to your specific necessities. Because if you already have a gum disease issue or a dental condition, then there are other types of mouthwash that can be recommended for you. Okay? Now, the question is, what happens if this dental plaque is not removed? Well, if it is not removed, it is going to build up and it accumulates, and then it's going to transform in something that is called calculus or tartar. This is a hard deposit that forms in between or teeth, even under the gum line. So when the plaque turns into tartar, it is not anymore colorless. Now it becomes like yellowish or even brown or pale yellow. The problem is that the bacteria that is in this tartar and in this dental plaque is going to produce acids after you eat or you drink, especially when eating sugary food. These acids that this bacteria produce, they are going to destroy the enamel of our teeth and cause cavities, and also it can cause gingivitis, which is gum disease. So this plaque can also form underneath the gum line and on the root of our teeth. And once this forms on the root, then it breaks down our bone. And this danger is that our teeth can become loose and they can even fall out on their own because they become so loose. Why? Because the bone and the gum and other tissues are what are holding our teeth or in place. So if because of this tartar or 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 bone breaks down and our gum is affected, then they're not able to hold our teeth in place the best way. So they're going to become loose, and that's why we are in danger of losing our teeth eventually. Okay. Now, what can we do to avoid these conditions? We have seen that if we do not remove the dental plaque, this dental plaque is going to build up and it's going to transform into something harder that is called tartar or calculus, and then this is going to develop in either uh, gum disease, or it's going to, the bacteria that are in this tartar are going to produce acids that will affect the enamel of our teeth and then eventually develop in cavities, and even we can even have bad breath and so many other things. So how can we avoid this? Well, the secret, as I mentioned before, is prevention. Prevention is always going to be the key. The daily oral hygiene habits are number one. They are proven to be effective to avoid these illnesses. Number two, the second thing we can do to avoid these conditions is with a balanced diet. A balanced diet that limits sugary beverages and snacks. I know it's hard for all of us to avoid sugars, but by limiting as much as you can, it is a plus, okay? And trying to eat healthy. The same way healthy food is going to be beneficial for our body in a whole, is that the same way healthy food will help strengthen our teeth and avoid these illnesses, okay? The third recommendation is to see your dentist regularly for prevention and treatment. Um, the recommendation is every 6 months. If you do not have any pain, at least every 6 months. Why every 6 months? Because sometimes people have dental conditions and they're not even aware that they have it. So it's important for you to have these checkups so the dentist can diagnose these problems on time and be treated before it is too late. Whenever we start having pain, it's normally too late. So I recommend you go and have dental checkups even before, even if you don't have any pain, okay? So what things can the dentist do to help you? Because I have been mentioning, okay, what can you do? What can you do at home? Which is very important and which is key. But also the dentist can do several things for you to help you with prevention. Number one is dental cleaning. Okay, so you have deep cleanings, which can remove the calculus, and this is recommended every 6 months. If you are a person that produces too much calculus, then it's recommended even more often, like every 4 months. If you have kids, you can take them to have regular cleanings also. Um, there are prevention uh, sealants. There are prevention sealants that can be applied to the molars also to avoid cavities. These are like a type of varnish that is placed on the maxillar surfaces of the molars. These like let me see here are the maxillar surfaces where there is more um, problems with cavities. Okay, normally the number one spot for cavities are these maxillary surfaces. So on these surfaces, the dental professional can place some varnish, and this varnish just like it works just like the varnish would protect the wood. That's the way it protects your teeth. So basically, these are the things the dentist can do to help you, but it is important for you at home to practice oral hygiene. One thing I would like to mention also is the brush. The there's a question people always ask, and is how often do I change my brush? How do I know if my brush is still working for me or not? Well, the answer is the brush needs to be changed every 3 months. Okay, every 3 to 4 months. But if before the 3 months those bristles are not are not they're open, they're not working properly, then you need to change your brush before the 3 months. Okay. Why does the brush need to be changed? Because it is almost every day in a humid environment, and this humid environment promotes the growth of bacteria, fungus. So it is important for you to change it, regularly, so you do not introduce in your mouth these bacteria when you brush your teeth. Okay. So normally when we see people, or we see pictures of oral health, um there are always pictures of perfect smiles. Okay. And the secret is not always, to have a perfect smile when you show your teeth. However your teeth are, the important is for them to be healthy. Okay, that's the most important, because everyone won't have perfect teeth, but the most important is to have healthy teeth. So I encourage you to practice these healthy habits daily, on a daily basis, so that you will be able to have a healthy oral health. Mhm. I don't know if there is any question.
Thank you so much, Dr. Pinnock, for that presentation. There are plenty of questions, and I'm sure more will come in once we start talking about these questions.
Okay.
First up, from Maria Thorne, does drinking lemon water every day damage the enamel if it's done in one sitting? In one sitting?
If it's done in,
In one sitting?
yeah, normally the acids are going to cause damage in our teeth. There are people that have problems with reflux, and there are the ones that normally have damaged enamel. So you need to be careful when drinking lemonade, lemon water, because this can damage your enamel.
Okay. From another guest, how often should we go to the dentist to get our teeth cleaned?
How often should we go to the dentist?
Yes, to get our teeth cleaned.
Yeah, it is recommended to visit every 6 months for cleaning. Okay, even though we may brush at home, even though we may use our dental floss, we may use our mouthwash. There are always surfaces that are where we're not able to reach properly. So it is important for us to have these regular cleanings, so to avoid the buildup of calculus, which is so problematic.
That makes sense. The next question is, when is absolutely necessary to get a root canal? What about a crown?
Okay, when do we do root canals? This is the reason why I told you that it is important to have the dental checkups every 6 months, because sometimes we have cavities and we don't even know we have them there. Cavities begin to have symptoms when the problem is already advanced. And when it's already advanced, sometimes it's too late. So when you have a cavity and the dentist identifies this cavity, if this cavity does not affect the pulp is like the heart of the tooth. If that part is not affected, if there is no infection, if the cavity is just in the enamel, which is the outer surface, um, you might only need a filling. But once this cavity has already reached the pulp, which is the heart, then there you might be having pain, and you will definitely need a root canal. Another reason for a root canal is like if you have a trauma, if you uh, accidentally haven't hit your tooth, and once you accidentally hit your tooth with such strength that the nerve dies, then that's another case where you are going to need a root canal. The root canal is to save the tooth, to avoid pulling out the tooth when the problem is already too advanced. The second question was about the crowns. The crown is needed when the tooth is too damaged to do a regular filling. So then if the damage is gone too far, then the only one of the methods of rebuilding that tooth is with a crown.
Okay, thank you. Another question from Anthony Blanc. Do natural products such as charcoal or certain tree roots or bark work better in preventing certain oral issues?
Yeah, there are always natural things that we can use that are going to be very beneficial, but it is always important for us to to um, to tell the dentist that what you're using, because sometimes everything is not good for everyone according to your individual case. So maybe you are trying some natural remedy for something that is already advanced, and then it won't help. So it is important for you to consult with your dentist. What things are you using for prevention, or whether for treatment of oral illnesses?
Okay. From McKenna Davis. Are electric brushes better than manual brushes?
Okay. Um, I actually did, this is many years ago, I did a research where I did the comparison of the electric brush versus the manual brush. But um, the comparison was done on children with physical impurities. So I do believe that the electric brush is very good. But if you are in your capabilities, if you have 100% capability to be able to use a manual brush and do the actions and do it correctly, then I prefer the manual brush. But if you are not able to move your hands correctly, and if you're not able to do whatever movement is required, then there is where I strongly believe, according to what the research we did, there's where the electric brush is better than the manual brush.
Thank you. Another question from Sophia Taylor Edwards. If you drink lemon water, should you use a straw?
Of course, it is better to use a straw so that the lemon water can go straight, to backwards, and not be encountered with with your teeth, of course. 100% recommended. Mhm.
Okay. From Francis Parker, what is the correlation between gum disease and other illnesses such as heart disease?
Yeah, there is relation between the gum disease, heart disease, diabetes, right?
Mhm.
If you do not have a controlled diabetes, if you do not have a controlled high pressure, if you have these illnesses there, and then you have gum disease, these will not you will not be able to be stable. Okay, so these patients normally when they are when there is a patient first diagnosed with whether diabetes or heart disease or high pressure, they have to be in control um, with the dental team because these bacteria will alterate your blood pressure and your diabetes. Yeah.
Okay, thank you. The next question is, I feel like if I do not brush my teeth with strength with a hard brush, they are not properly clean. Is this okay to use a hard brush?
Okay. Many people believe, and this is a question now that people ask me almost daily. Many people believe that the secret with brushing is strength, and the secret is not strength. The secret is technique. What happens when we brush with too much strength or with a hard brush? We can damage our gum. We can damage the enamel of our teeth, right? And this can develop in other problems like if we brush so hard that we damage our enamel, then this damage can reach to even to the root, and we can be in danger of losing our teeth. So it is recommended to use a soft bristle brush, and instead of using strength, we should use technique to brush your teeth.
I see. Another question from Clark. Can tooth infection cause pericarditis?
I'm sorry?
Can tooth infection cause pericarditis?
Can tooth infection cause pericarditis?
Pericarditis, yes.
Pericarditis. I'm not sure about that. Yeah, I'm not
Okay,
sure. I would have to consult that. Yeah.
okay. Um, the next question
Is
is
the word pericarditis? Pericarditis?
pericarditis, yes.
Oh yeah, of
Yeah.
course. If the tooth is infected, this infection can go to your bloodstream stream, right? And if this tooth infection uh cause these bacteria to go in your bloodstream, of course it can cause pericarditis. Yeah, and this can even cause death.
Yes, very true. The next question is, when is the best time to floss? Before or after brushing?
Okay, the best time to floss is before brushing your teeth. Why? Because when you floss, you are actually taking out whatever remains of food you have in between your teeth and under the gum line. So once you take this out, then you brush to remove it. So definitely it is recommended to floss first and then to brush your teeth.
Okay. And where does mouthwash fit into that? Is mouthwash needed? And if so, what's your favorite one?
Well, if I mention two type of mouthwashes, right? So you have the cosmetic and the therapeutic. I rather the therapeutic because they basically eliminate some of the bacteria that can cause gum disease and dental decay, tooth decay. So I would prefer the therapeutic, but then it's not about just going and get any therapeutic mouthwash. It all depends on what are your needs, right? So in my case, I won't go with any brand. I just recommend a mouthwash that can kill germs. Okay, it's not about just the fresh scent. It's about killing germs.
Right. The next question says, if you have heart disease, is it necessary to take medication prior to doing dental work?
It all depends and how um how dangerous is the heart disease that you have. Okay, because this normally is done with the cardiologist. We consult with the cardiologist, and if the cardiologist recommends you to take medication before treatment, then it is done. If the cardiologist says no, it's okay, you don't need it, then it is not needed. So we do not recommend you to just go and randomly take medications just because it has to be recommended. But yes, most heart uh, uh, diseases are you will need to take medication if you are going to have a procedure that may cause risk. Because if you are just going to do a simple procedure, then you won't need any medication.
Okay. Someone is asking, what is that mouthwash? The name was not clear. I think they're asking for a specific brand, maybe.
What is
What is that mouthwash that you mentioned?
that I mentioned? Any
Yes.
mouthwash that kills germs. You just have to read the label and you will know. And if you are having a gum issue, then we prescribe other mouthwashes like in Spanish for us it's clorexidina. I don't know if what is the name you use over there for it, but in our case it's the main one is clorexidina, right? But then that's prescribed. But basically, if it's just for prevention, you all you need is just a mouthwash that kills germs.
Okay. Another question is, can sealants be applied for adults? Is it as effective um, compared to when you're a child or a teenager?
Yes, sealants can be applied to adults, but then we recommend sealants for those molars that have those molars which structures are very deep. Okay, in this surface, if the structure is very deep, then we recommend the sealant because the deeper it is, then the bacteria will go deeper and it's harder for the brush to clean there. So there's where we recommend it. Whether if you are young or you're an adult, we use it, right? But one thing you have to have keep in mind with this is that if you like to chew gum or you like eating sticky food, then you can this sealant can fall off. So Once you have the sealant, you need to be able to be going to regular checkups to just make sure the sealant is still there. But yes, it can be applied to children or adults. It's mostly applied to children, but it can also be applied to adults.
Okay, that sounds good. If there are no other questions, I think that concludes our seminar. And I would like to thank you so much, Dr. Pinnock, for joining us and for giving us an awesome presentation, helping us take care of our teeth. And I would love to thank all of the viewers for the amazing questions and for hanging around and being interactive. Thank you so much. I think we can do a closing prayer, so I'll do
Yeah,
that.
thank you so much for having me. And we're able to present the images, the slides for you to get a better understanding. But I hope you were able to understand, and hopefully, you know, this may not be the last time, but I can be with you another time so we can even interact
We
more.
would love that. We need a part two, yes. So I'll give a closing prayer.
Okay.
Okay. Dear Lord, thank you for having and letting us have this time with Dr. Pinnock, where she let us know so many good things about how to take care of our oral health and our overall health together. Please help us to apply these things as we go on to the rest of our night and the rest of our week. And thank you so much for this opportunity. In your name, amen.
Hey.